There are 5 common drugs in your medicine cabinet right now that are silently destroying your kidneys. And drug number 3 is the most common medication people take in America. I'm Dr. Osama Ibrahim, a specialist in kidney disease and hemodialysis. And I can tell you that I've seen with my own eyes many patients who ended up on hemodialysis because of medications they were taking daily at home, without knowing that these drugs were harming their kidneys and destroying them completely. Today, I'll tell you what these drugs are, and I'll also tell you why they destroy the kidneys and what signs you should ask your doctor about before taking another pill of these medications. At the end of the video, I'll tell you about the #1 drug that 90% of Americans take, thinking that it's completely safe. Unfortunately, it's the most dangerous drug that can lead to chronic kidney failure. Let me tell you the story of Dorothy. Dorothy is 68 years old. Every day she took an ibuprofen pill because she had pain in her knee. For 3 full years, she took 1 pill in the morning and 1 pill in the evening. But the question here is, did anyone tell her that this drug wasn't safe? The answer is no. The pharmacist told her to take it. And the orthopedic doctor she was seeing told her to take it. Also, the advertisements that appear for this drug say that it's safe. She went for a routine checkup and found her kidney function had dropped to 38%, meaning she lost more than half of her kidney function. And unfortunately, she didn't feel a thing. Did you know that 37 million Americans have kidney disease? And 9 out of 10 of them don't know it, unfortunately, because the kidney has a huge reserve capacity. It can lose half of its function without you feeling anything at all, until we reach a point where it's too late for us to intervene. Each kidney in your body has about 1 million tiny filters. We call this filter a nephron. This filter works 24 hours a day. It purifies and rids it of waste and excess water. It also regulates your blood pressure and blood sugar. This isn't an ordinary filter. It's a very precise and sensitive filter. Now, imagine that there are drugs that go to this filter and do one of 3 things. They narrow the blood vessels that supply the kidneys. So the filter, quite simply, is like it's starving to death. Second, they cause direct inflammation in the kidney tissue. Third, small crystals are deposited inside this filter and clog it up, just like a water filter when you go to change it. And these 3, unfortunately, happen in complete silence without any symptom till the kidney completely stops working. Let me start with the list of 5 drugs that cause destruction to your kidneys. And I'm telling you right now, if you're taking any of these drugs, don't stop immediately on your own, but consult your doctor, because some of these drugs must be stopped gradually. Drug number 5, kidney detox supplements and high doses of vitamin C. People buy supplements called kidney detox or kidney cleanse, and they think that these things clean the kidneys, and that's the disaster. The truth is that there is no scientific study showing that these supplements benefit the kidneys. In fact, some of them cause direct damage to the kidneys. Also, vitamin C in very high doses, because many people take it on the basis that it improves immunity. High doses, which are more than 2,000 milligrams daily. The body converts the excess of this calcium into oxalates, and these oxalates are deposited in the kidneys and form stones. And this, unfortunately, can cause severe damage to the kidneys. And speaking of nutritional supplements, we actually made a special video about a kidney detox system that protects your kidneys and improves kidney function within 24 hours. This system is based on scientific facts, not on nutritional supplements you buy online. I strongly advise you to watch this video after you finish this one. I'll leave a link to the video in the description or in the iCard that'll appear now. A video that will explain the truth about the nutritional supplements that many people buy daily. Drug number 4, phosphate laxatives. Have you ever done something called a colon cleanse? Something called a fleet enema. This contains something called sodium phosphate, and many elderly people use it to clean the colon. Some people take it and nothing happens, but other people take it and it can cause them something called acute phosphate nephropathy. What does that mean? This is acute kidney injury, which, God forbid, can turn into a chronic disease. A while ago, I read on Reddit someone asking a question that his mother was using this enema, and it caused her acute kidney failure, unfortunately. It turned into chronic kidney failure, and she started dialysis, and this is real, not a rumor. Drug number 3 is a very famous drug, which is Ozempic, or GLP-1, and this is the most common topic today. Millions of Americans are taking it. Ozempic, Wegovy, and Mounjaro injections for lowering blood sugar or for weight loss. And these medications are actually useful in terms of lowering blood sugar. But their side effects, which not many people might tell you about, are constant vomiting and nausea. And when the body loses a lot of fluids due to vomiting or diarrhea, severe dehydration occurs. And the kidney, as I told you, needs a constant blood flow at a certain pressure to function. When dehydration happens, blood pressure drops and the kidney starts to stop working. And this is what we call acute kidney injury. or temporary acute renal failure. Studies say that many people have gone into temporary acute renal failure after using Ozempic and Mounjaro injections. And this isn't due to the drugs, but the dehydration they can cause, which if we don't notice and treat, could cause a disaster for the kidney. And speaking of Ozempic and weight loss medications, we have a podcast with Dr. Basayuni, a medical consultant, family and elderly health. It talks about all Ozempic medications and weight loss drugs. Who should be taking them? What are the side effects and the right dosages? I highly recommend watching this podcast after this video. This video is very important if you're taking Ozempic or Mounjaro or if you're about to start. I'll leave a link to the video in the description or in the iCard that appears. Let's continue. Before we do, if you find the content we provide helpful, please go ahead and leave a comment below, letting us know where you're watching from. And if you're taking any blood sugar lowering drugs like Ozempic or Mounjaro, tell us the name of the drug you're on. Also, give us a like, as it helps spread the medical content we provide. Let's continue. Drug number 2, antacids. 15 million Americans take antacids every day, like Omeprazole, Nexium, and PPIs. Unfortunately, no one tells them that they can cause inflammation in the kidney tissue, leading to acute renal failure, which leads to something called acute interstitial nephritis. What does that mean? Your body has an immune response against the kidney tissue itself. The kidneys get inflamed and the filters are destroyed. The most dangerous part is that this problem can occur weeks or months after starting the medication. And you might not feel any symptoms at all until kidney function starts to drop to a dangerous level. But there's one sign you might notice in your urine that tells you your kidneys are starting to be affected. I'll tell you about it in a little bit. Drug number 1, the non-steroidal group, or painkillers, Ibuprofen, Advil, Aleve, Motrin, and Naproxen. The most common painkillers in America, and no one remembers that they're the leading cause of kidney injury. No one thinks twice before taking a single pill of these medications that these drugs are the leading cause of drug-related kidney injury in America. This non-steroidal group works by inhibiting an enzyme called prostaglandin. And this prostaglandin is what opens the blood vessels that supply the kidneys. Simply put, when you take this medication, you're turning off the faucet that delivers blood to the kidneys. And this isn't just my opinion. These are the recommendations of the Global Kidney Organization, KDIGO, and the National Kidney Foundation. For anyone with diabetes, high blood pressure, or CKD, these drugs can be very dangerous for them, especially if they're taking blood pressure medication along with these painkillers. Unfortunately, this combination is very deadly and dangerous, and it's known as the triple whammy. Non-steroidal painkillers plus ACE inhibitors, or ARBs, plus diuretics. These 3 drugs are a triple threat that destroys the kidneys. We made a special video about Michael's true story, a patient who was watching World Cup matches at the stadium. Unfortunately, he was taking NSAIDs for back pain. At the same time, he took ARBs and ACE inhibitors for his back and suffered severe dehydration due to the extreme heat in the stadium. This led to temporary acute kidney failure that could have led to chronic kidney failure. It's a very important episode 1 recommend you watch after this video. I'll leave a link to the video in the description or in the eye icon that'll appear on the screen. So what's the sign you should pay attention to that we talked about? The famous sign is foamy urine. Foamy urine, bubbles in the urine, bubbles like egg foam appearing on the surface of the urine. This indicates protein leaking into the urine. Also, swelling in the ankles, knees, and around the eyes, especially in the morning. Constant fatigue, even if you get enough sleep. Your urine changes color, amount, or smell. And we have a special video about the signs your urine color can tell you about your kidney health. You'll also find it in the video description or in the eye icon that will appear above. A very important video that will teach you about urine color and its effect on your kidneys. The last sign is persistent skin itching without any reason and without any rash or skin symptom. A very important point. Who are the people most at risk for kidney disease? Patients over 60 years old, because kidney function decreases with age. Second group, people with diabetes or high blood pressure. The third group, people with chronic diseases who are prescribed painkillers on a frequent daily basis. The last group are those with a medical history of kidney problems. The final group is people who take many dietary supplements and medications from the internet without any medical supervision. If you're in any of these categories, it means your kidneys are more sensitive. This doesn't mean you shouldn't take any medicine, but it means you should ask your doctor about any medicine before taking it so they can prescribe a safe alternative if that medicine isn't suitable for you. Now, some people will ask me, "Doctor, I need to take painkillers because I have chronic diseases." The truth is, there's a safe alternative to painkillers other than NSAIDs. Like what? Like acetaminophen, or its brand name Tylenol. This medicine is safer for the kidneys. If you're in pain and need a painkiller, ask your doctor about this medicine. Also, if you have heartburn and take antacids as we agreed, check with your doctor to see if there are alternatives or not. We agreed that Ozempic or weight loss drugs, dehydration as a side effect is the biggest danger to your kidneys. So what should you do? Most importantly, get these 2 tests done, a blood creatinine test and a GFR and albumin-creatinine ratio test. You can also get a routine urine test. These tests can detect potential kidney damage before it even starts. The National Kidney Foundation in the United States recommends that everyone get these tests done at least once a year. Prevention's much easier than having to go through kidney dialysis. If this video helped you, share it with your loved ones who take these medications regularly, as it could save their kidneys. And remember, we made this video today with your well-being in mind. We hope you've done something good today too, and try to make it a habit. Don't forget to watch the video on the screen about 5 things your urine can reveal about your kidneys, so you can recognize the warning signs before it's too late. I'll see you next week to check in and keep you informed. Take care.